Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Meet me in your coziest chair while we navigate the highs and lows, the twists and turns of the vestibular universe. Welcome to Grounded. Let's dive in. Hello, my friends. I am here to tell you about something today, and I swore I would never record this podcast again with Tugboat in the room with me, but here we are. He is being a chaos monster. But you know what? I have been inspired to record this podcast after 4 of my patients have been in a pretty gnarly situation from this specific thing. And so today I want to talk to you, if you didn't read the title, about weaning on and off of medications. This is educational. Of course, this is never medical advice. Please talk to your doctor about this. But I have seen this time and time and time again, and I'm sick of seeing it, frankly. And so I am just going to tell you what you need to talk to your doctor about. If you have vestibular migraine and you're listening to this, which most people who listen to this have vestibular migraine, triple PD, some sort of vestibular disorder, mostly vestibular migraine, and you have been put on a medication, that is great. And if it's working for you, that's awesome. I know for a lot of people, your goals might be to get off that medication at some point or another, or maybe the medication isn't working for you and it's causing side effects, so you need to wean off the medication. There's a million reasons to be on a med and a million reasons to be off a med. And I respect both of those decisions and reasonings, and it's between you and your doctor and all the things. So I want to say that up front. Secondarily, if you want to wean off of a medication, it is really, really, really important to understand how. Because people with vestibular migraine and other vestibular disorders tend to be hypersensitive to medication. It's no fault of your own. It happens. You might be more sensitive for a million different reasons. You might have always been sensitive your whole life. You might have new sensitivities because, like, since you have vestibular migraine diagnosis and symptoms, we're going to be talking all about these types of sensitivities and things at the Vestibular Virtual Summit. So definitely join us there. If you haven't gotten tickets yet, I'll put them in the show notes below. However, I want to specifically talk to you about weaning. Now, the amount and how you wean is going to be different from person to person. So, general educational guidelines, remember, this is not me telling you to wean off your medication or exactly how to do it, but this is how I want you to talk to your doctor about it. Even if you are on the lowest dose, even if you are on a quote non-therapeutic dose, it might still be doing something for you. And the interesting thing that we do not know about genetics and how our genes work is that we literally do not know yet what medication might work best for some person unless you get a specific genetic test, right? How sensitive or how much you might need unless you try it, right? Trial and error is our friend in the vestibular world. So let's get to the point here. The point is, if you are on a medication and you would like to wean off of that medication, you must do it slowly. I am begging you to talk to your doctor and ask them to give you specific guidelines on how to wean off your medications. And that does not mean if you're on 10 milligrams of nortriptyline to quit cold turkey. If you're on 25 milligrams of Topamax to just stop tomorrow. Because although those are low doses of these medications, all things considered, 37.5 of Effexor, whatever, you actually need to go more slowly than that because your brain may or may not be hypersensitive. I have had patients have really frankly awful side effects recently from quitting these medications cold turkey, even from the lowest of doses. So oftentimes you can get nortriptyline in the children's dose and ask them to, so it'll be a liquid and you can wean yourself down that way, like 10, 8, 6, 5, 4, 3, literally like so slowly over weeks to months. Like I know someone who it's taken a year for them to get off of Effexor from 37.5, which is the quote lowest dose. You would take the capsule apart, then you would put specific number of beads in there in a different vegetable capsule. So you can like order vegetable capsules on Amazon. Again, talk to your doctor about this. Do not do it just because I'm saying people should do it on Instagram, but I have seen really awful side effects of people quitting cold turkey. And it's not their fault because their doctor said, hey, quit this cold turkey. We're going to switch the medication or whatever. We're going to stop this medication immediately. Boy. We're going to stop this medication and we're just going to start another one, and been seeing a lot of side effects from that. And I do not want that for you. You can see my tone is maybe a little different today. It's because I'm really frustrated. This has happened to 4 of my patients in the last 2 weeks. And it's been just a really frustrating situation. So when you're weaning off medications, what are the considerations? So before you wean off a medication, right, we're usually using the space that the medication has created for you, meaning like the symptoms should hopefully reduce from a medication, right, to provide you with the space to do all of the other things to manage migraine that are not take a medication. So specifically, breathing, yoga, strength training, walking, so just generally exercising, breathing, meditation, grounding, resting more, de-stressing, setting boundaries, supplements, neuromodulation devices, all of these other things that have fewer or no side effects, right? You want to create this whole treatment pie. And that's what we do in Vestibular Group Fit. Remember, use code GROUNDED for 15% off your first subscription cycle. And I, as a physical therapist, cannot prescribe medication. It is so out of my wheelhouse. It is so not my job. But most of my patients take some sort of medication. And so it's about like how you use that space in order to do these other things. So when you're like, okay, I have a really solid grasp on, I have better boundaries at work, I'm not as stressed out, I take my supplements, I do my neuromodulation device, I exercise 4 to 7 days a week, I strength train, I have been eating more protein, I've been reducing my processed foods, I've been hydrating, taking an electrolyte, like you name it, right? When you do those things, your migraine frequency and migraine intensity and your general symptoms will reduce. That's how that works, which is fantastic, right? So then you're like, okay, maybe it's time. I am having fewer attacks, maybe 1 attack a month, a couple attacks a month, depends on the person. And when you are thinking about that, you can say, okay, maybe it's now time for me to wean down off of this medication, which is great. Awesome. A choice that you and your doctor can make. Maybe you don't want to wean off that medication. Maybe you do want to wean off that medication. Again, completely and totally up to you. And it's between you and your doctor because, again, this is not medical advice. But if you do say, okay, it's time for me to wean, here's what I'm going to do. Really focus hard for a couple weeks before you start on making sure that those new habits that you've built over the last like year, 6 months, year and a half, whatever, are really in line. Your schedule is great. You're sleeping the same hours each night. You're doing your breathing every day. You're whatever, all those things. Make sure they're really like a part of your schedule. And you're like, okay, I'm feeling really good about these. Then wean. Maybe you start with going 2.5 milligrams down. Maybe you start with going 5 milligrams down. It really just depends on the dose, the medication, all the things, right? During the couple of weeks that follow that, you may notice an increase of symptoms or even withdrawal symptoms, different things like that. If that happens, then you need to double down on the things that make you feel good. Your diet, your exercise, your nutrition, making sure that you are breathing, making sure that you're using your neuromodulation device, make sure you're sleeping really well, make sure that you aren't grinding your teeth at night. Maybe you are extra stressed at work, right? making sure that those things are in your schedule and going well, and then you wean again. And this can take literally weeks, months, years to get off of a medication, and that is okay, especially if you know that you are the sensitive type. If you feel like, hey, yeah, I'm like, I try a new food or I try a new medication and like it really affects me, or like I've heard people say, like, I'm the type of person who can only take like one half of an Advil or I have an overreaction to it. Like these things, you are not alone. If that sounds like you, these things aren't like super crazy abnormal, but it is something to know and to go, okay, I understand how to do this now, and I'm going to do it slowly. And tell your doctor, hey, I don't feel comfortable quitting this cold turkey despite it being the lowest dose because I am a sensitive person and I would like some guidance on how to wean properly. Or I heard this way to wean of going down 2.5 and then 2.5 more, or 5 and then 5, whatever. Remember, it depends on the medication, the dose, your personal body, all of your current habits, all the things. That's not a medication or a decision that I can make for you. It's also not a medication I can make for you. Um, but my point here is to please, please, please do this slowly because it is something that does affect your brain. It does affect your gut health. It does affect your body, right? You are a sum of your parts. You are not just one part. Right? You're not just treating your brain when it comes to migraine. We need to look at this from a holistic, bigger standpoint. We need to consider all of the things that your body is going through. We need to look at your hormones. We need to look at your thyroid. We need to look at your gut health, like all of these things. And your medications, they do affect these other parts of your body. Again, if it's the thing that makes you have no more vertigo and you're having so many fewer attacks and you're able to also implement all these other things, like that is fantastic. Like I totally support that. That's great. But we also, right, we want to avoid medication overuse and making sure that we're not just like treating the side effects with more medications and things like that. So we're not just like stacking them and stacking them and stacking them. All that to say, my whole point of getting on here and saying this very quick episode is to please wean slowly no matter what. Tell your doctor that you're going to do it. Ask them for their guidance. And if they say, oh, you don't need to do that, you are allowed to say, but I would like to try it. And how can you support me in that? Or, but I would like to try it. And so I'm not going to start this other medication for X number of weeks. And if you're like, you know what, I'm the kind of person who's not super sensitive and I think that I'd be okay going off of it, you can also try that, right? Like this decision is ultimately yours. And you get to decide what is best for you and your body. So if you have any questions, remember you can always ask me in vestibular group fit. I am always here to answer your questions. I love you and I will see you later.